Hello, I greet you. Today I would like to discuss the various checkpoints involved in a leg lengthening with you. The checkpoints differ a bit between thigh lengthening and lower leg lengthening, but these are points we have defined that every patient should basically reach and that every patient does reach. It gives them a little bit more of planning security, or rather, a bit more. A pattern where they can follow along, which helps them to better understand the leg lengthening and also plan how they will regenerate, thus providing a sense of security. When we start, it is the day of the surgery. On the day of the surgery, they come to the hospital. Then I perform the surgery in the thigh area, which takes approximately 2.5 to 3 hours for both thighs. In the lower leg area, it always takes a little bit longer, so we're looking at 5 hours for both lower legs, simply because they are significantly more complex surgically. After the surgery, they go to the recovery room. In the recovery room, they stay for about 2 hours and then move to the private clinic room, where they will be cared for by us for the next 5 days. Sometimes, on the same day of the surgery, I get up with the thigh lengthening patients, and then we can start their mobilization. Mobilization usually begins with forearm crutches, as this helps them gain security. There, they can train a controlled gait pattern. However, it is often the case that they experience a bit of dizziness, some nausea and low blood pressure from the anesthesia, which usually resolves over the course of the day. As a result, they are not mobilized on the same day as the surgery, but at the latest on day 1 after the surgery. This is our minimum requirement that they must achieve. That means on day 1 after the surgery, they must be on their feet, they must be mobile. Wheelchairs or anything similar are prohibited at their institute. Then from day 1 to day 5 is the phase in the hospital setting where they are constantly taken out of bed and mobilization is carried out by the entire team and monitored closely. This means they first learn to walk with forearm crutches using the step 2 gait, then progress to walking with forearm crutches using the step through gait, and continuously increase their walking radius as part of the initial mobilization. Day 5, we can also see it here on the timeline. Day 5 is generally the day when they transition to rehabilitation. In the rehabilitation area, they first have a day of recovery, and then we start the leg lengthening with them. That means in the thigh lengthening area, we show them how to independently operate the lengthening mechanism, which means doing the clicking, and at the same time, we start teaching them how to do their stretching exercises. This overlaps a bit, especially in the next few days, because in the initial phase, it is not yet absolutely necessary for them to focus so much on the stretching exercises. There is no tension present yet. You first build up the tension by clicking for a few days to weeks, putting the muscles under tension. This is not a priority in the first phase, so they must definitely reach the checkpoint of independent clicking. This means they must carry out the lengthening process independently and without issues during rehabilitation. This is generally achieved by all patients and is not a major concern. And then the next focus is on teaching them how to perform their stretching exercises independently, how to change positions independently, because it's all a bit different when you have mobile legs compared to stiff legs. You still need to use some aids for that. Learning adaptations, training compensatory mechanisms, they are shown all of this during the rehabilitation phase. This is generally until day 14. After day 14, they should definitely have passed the checkpoint independent clicking. You should definitely be mobile, sometimes with forearm crutches covering a very good distance. They should perform their stretching exercises independently and very well. The wounds are healed and clean. These are all the checkpoints that they must have reached. Then comes the next checkpoint, which they will notice best themselves, namely the tension phase. The tension phase begins approximately in the thigh area at 1.5 centimeters and generally lasts around 4 to 5 cm. This is highly individual, and I receive this feedback from patients repeatedly. From a certain lengthening stage, it becomes significantly easier to stretch, mobilization becomes much easier, and the whole process, if they have managed to stay balanced until then, becomes much easier compared to before. And generally, it is in the range of 4 to 5 centimeters where it becomes a bit easier and where they should have definitely found their balance. That means the important phase and the really strenuous phase is between 1.5 and 4 centimeters. They should make sure they are balanced, they should make sure they are mobile, and they should definitely avoid muscular deficits. After 4 centimeters, they need to have developed a structured routine with the daily schedule essentially being the same, and then they run the marathon to their goal, whether it's 8, 9, or 10 centimeters, and then they stop clicking. Then they have reached the clicking checkpoint, so to speak. In between, we have our x-rays. Generally, we take x-rays every 6 to 8 weeks, and then again at 10 centimeters at the end of the entire lengthening process. After that, the consolidation phase continues. In the consolidation phase, it is still necessary for the gap, the bony gap, to still solidify first. The bone here must regrow properly and effectively when they have low tension in order to function correctly. That means if they are in balance, ideally without any muscular deficit, standing upright with hips aligned and legs closed, they can expect to have a somewhat normal gait without forearm crutches approximately 8 to 12 weeks after stopping the lengthening. This is the fastest they can ever achieve. For this, these gaps must be somewhat to a certain extent fixed with bone. As long as they are not yet fixed with bone, they will always have a somewhat unsteady gait. I will explain this again in another video. As long as they are still open, they will have problems with a normal gait. Once they are fixed, they will have the chance to walk normally. This means that the focus here is not only on stretching exercises, but also on muscle strengthening and optimizing the gait pattern. And then, after they have reached the whole thing, they also have the chance to build themselves up athletically 8 to 12 weeks after stopping the clicking. That means they then begin to gradually and consistently train themselves on the treadmill. I always recommend starting slowly. That means begin with 5 kilometers per H for 5 minutes and do this 4 out of 7 days a week. That means everything they do during the consolidation phase in terms of athletic development and recovery after a leg lengthening must be done slowly and gradually, very slowly and gradually. It won't do them any good if they really start going on the treadmill and try to jog like they did before. They will have pain afterwards, but they need to establish a baseline, start at a low level, and then consistently follow through 4 out of 7 days a week, and then slowly increase it week by week. I always recommend increasing alternately. That means the week after, increase the length of jogging by 5 minutes, then again by 1 kilometer per H speed, then again by 5 minutes duration, and so on and so forth. Then they have a period of weeks to months during which they can catch up to their normal athletic condition. The same applies to strength training. We also have very clear guidelines here, 8 to 12 weeks after the lengthening. During this period, we also incorporate muscle strengthening exercises. When you start doing strengthening exercises again, please begin without any weight at first. Then you can initially add 10 kilograms of weight every 2 weeks, allowing your muscles and bones to gradually, steadily, and slowly adapt. When we now talk about the area of checkpoints in the lower leg lengthening, it is almost identical. It just takes a little longer. We have the surgery day, and here we have the surgery lasting 5 hours, followed by the recovery room, and then essentially the clinic room. Here, it is generally the case that we get the patients up for the first time on the first post-operative day because they still have drains. The drains need to be removed first. Mobilization at the beginning is generally a bit more difficult. That means the initial phase in the lower leg lengthening is generally always a bit slower and longer compared to the thigh lengthening. Then we have the next checkpoint when they go to rehab. The transition between the hospital and rehabilitation for lower leg lengthening is after 7 days. Not after approximately 4 to 5 days, but after 7 days for monitoring to ensure everything is all right and because they need a bit longer to become fluidly mobile. In the rehabilitation area, it proceeds in the same way as in the thigh lengthening area. First, they are trained to click independently. After they have been trained to click independently, we show them the exercises they need to perform for the stretching exercise, train with them in mobilization, and so on, so that they learn a proper gait pattern, are truly mobile with forearm crutches, and can cover good distances. In the lower leg area, patients really struggle with swelling, immobilization, and getting on their feet with forearm crutches during the first 4 to 6 weeks. This is completely normal. After 6 weeks, the progress is significantly faster than in the thigh lengthening area, for one. Secondly, the tension phase is not as early as in the thigh area. This is simply because there is less muscular mass in the lower leg area, and this muscular mass is more unilateral, specifically in the calf area. You don't have it on the front side, the whole muscular mass, and also not 360 degrees circular like in the thigh lengthening area. That means After 6 to 8 weeks, the lower leg lengthening usually catches up to the thigh lengthening and they are then mobile. The focus in lower leg lengthening is really on mobilization. This means they need to have a good gait, they need to walk, they need to move. Then comes the next checkpoint, stopping the lengthening. Stopping the lengthening is similar to the thigh lengthening process. 8 to 12 weeks after that, I would expect a normal gait pattern, even with weaned off forearm crutches. The ossification in the lower leg area takes a very, very long time. This is completely normal. In the lower leg lengthening area, it takes almost twice as long to ossify compared to the thigh lengthening area. But that's just how it is. You basically need to be patient. We take regular x-rays afterwards, and as soon as the ossification has progressed, you can start training again, and you can get back on the treadmill, just like in the thigh lengthening area. Then also do strength training. I hope the individual phases have become clear and that you have gained an overall understanding of the individual proportions or the lengthening of the individual proportions. The overall picture has become somewhat clearer. Thank you for that.